It says recording in progress, so it's recording.
Perfect. So good afternoon, everyone. Thank you for joining us. We are here today to talk about plastic surgery options with body contouring with Dr. Fripp, a board-certified plastic and reconstructive surgeon with University of Maryland Capital Region Health. Thank you for joining us, Dr. Fripp. We appreciate your time today.
Thank you for having me.
Our pleasure. So tell us a little bit about body contouring and what that means.
So you can advance the slide, Bobby. So body contouring is a term we use because we don't want patients to be confused with weight loss. So body contouring is when you have extra adipose tissue on your body, or if you have extra skin, removing both and contouring the body in a way that you desire. Some people say, I've never had a waist, I want a waist. Some people say, I want to be able to wear pants and not have a fullness in the front. Other people say, I don't like the rolls that appear on my body under my bra line. There can be different areas, and it's a very individual thing, but we use the term body contouring to describe the fact that we are actually shaping the body. So in my practice, I perform surgical enhancement procedures from the clavicle to the knees. So I don't operate on the face. We do non-surgical enhancements of the face in the practice, and that is the Botox, the fillers, the microdermabrasion, the peels. So we serve patients locally from DC, Maryland, and Virginia as well, because we have an office in National Harbor. And so we can see Virginia and they can see us. And so we welcome patients from across the lake as well. But we have that office in Bowie serves our DC and Maryland populations mainly. And so my goal when I see a patient is to provide natural enhancement of the body. So I do not do things that will shock people. I do not want my patients going back and people like, oh my. I want people to go back and have comments said, you look so refreshed, or you look so good, you look so comfortable in your body. That's what we're going for. Next slide, please. So I like to share a few facts and pearls before I get into any conversation, because I think people have a distorted perception of what plastic surgery is. And it is mainly the fault of TV, print, and internet, because they don't tell you that a film has been edited, or a picture has been airbrushed, or an image has been photoshopped. We think that that's exactly how it is, and that's not true. But the first and foremost, it is incredibly important to have a plastic surgeon perform your surgery. Not because of our expertise alone, because most plastic surgeons train for a minimum of 7 years, but also because we know how to handle complications if they occur. In our training, we see the good, the bad, the ugly, and we know how to make everything even out because we are trained to do this. If you are a person who's had a weekend course in how to liposuction, or you've shadowed somebody for a month or two, or even a year, that's not the same as having the direct responsibility that comes with having the training. And so one other thing is patients are often told different information on the street. And the truth is cosmetic procedures are not covered by insurance. I don't take insurance for cosmetic procedures. There's no code that I'm going to use to make it say something. I'm just not going to do that. I think we have to play fair, because insurance companies will cover things that are necessary, that are functional. And so when I submit to the insurance company, they know they can trust me. And so we submit claims and they're approved almost with 100% return, because they can trust that I am telling them that. And lastly, one thing I want patients to always keep in mind is you can't compare yourself to anyone else. You are one of one. I have twins, and even with my twins, they're completely different people. They're just brothers. 2 boys born within 16 minutes of each other, carried in the same womb, but they are totally different, and they're twins. So you can imagine if your girlfriend were to go and say she had an experience, and good or bad, you want to duplicate that, that may not be your experience, because you don't have the same genetic makeup that she has. You don't know how she heals, how your tissue will respond. And so let's just go in thinking, I want to be the best me. It is okay if you bring a photo to guide your surgeon to show how you want to be contoured. But keep in mind that photo is not you. You will be showing them an example of what you would like to create with your own body. Next slide.
But before we go to the next one, so can I ask a question about travel, about medical tourism and people that go to Mexico to get, butt implants and all this fun stuff? You recommend against that?
So medical tourism is domestic and international because people will travel to, let's say, Miami to get a butt lift. People will travel, let's say, to Texas to get their breasts enhanced. So medical tourism is both domestically in the United States and internationally. What I would say is, people always say, well, the international surgeons are not good. That's not true. They're plastic surgeons, and most of them have done training in the US or in their own country. The problem is you need follow-up. And when you travel for surgery, you don't have adequate follow-up because unless you plan on staying in that place for 6 weeks, you will not get the proper follow-up. So you have to pray that nothing goes wrong. Additionally, when you do return to your home, I, for example, don't see follow-ups for other people. I don't follow up other surgeons. So who is going to be following you up? A family practice doctor, an emergency room doctor, they're not plastic surgeons. So anything that could have been tweaked or fixed will be missed because that is not what they do. Now I take my hat off to all ER doctors and all family practice doctors because you all manage a whole host of the conditions that I don't do, but they are not surgeons. And so they're not trained to be plastic surgeons either. So when you do this travel for surgery, and I'm not saying you shouldn't go to the best. If you think that the best person is in Alabama, you just need to make sure that your post-op follow-up is pre-arranged and you will either travel back to see that person or that person has a relationship with someone in your area who can follow you up. That is the danger because God forbid you get an infection and it is not treated immediately, then you have complications that are far worse and far outweigh any financial savings you could have had.
Great, thank you very much.
You're welcome. So let's jump right into it. This talk is primarily body contouring options for people who are not going to be surgical candidates, okay? I'm sorry, who are not going to be using their insurance, apologies. So at the breast, you have to ask yourself, what do you want to do? Do you want to keep your size, but lift them higher on your chest wall? Do you want to make your breast larger? Do you want to make your breast smaller? So if you want to keep the same size you have, but gravity, aging, nursing, just living have caused your breasts to be lower on your chest than you want them to be, then that procedure is called a mastopexy. Think about pexy is to lift, to peck, to place something. So masto means breast. So you'll be lifting the breast higher on the chest wall. We typically remove a little skin in order to cinch around the breast tissue and we place it higher, typically what we call the anatomical triangle, so that the breasts sit on the chest wall at their proper space. If you want your breasts to be larger, we all have heard about breast augmentation. We know that there are a litany of options now between gel or saline. We can go above or below the muscle. We can place the incision under the breast, around the areola, in the underarm, through the umbilicus or belly button. There are long-term risks, though, of augmentation that have to be discussed, and I think this is the step people miss. There is a very rare cancer that has been linked to breast implants. We have not been able to fully elucidate what the cause is, but we do think it had to do with the rippling on the implant, bacteria seeding the implant, or bacteria getting inside the implant, or there being some blood around the implant at the time of it being placed that causes a biofilm to form, and then our inflammation or inflammatory process starts and then cancer develops. Again, this is a very small number. I mean, incredibly small, but that only matters if it happens to you, right? So you just need to go into everything knowing the risk. And then the size. We typically say that the size should be within your base width, the width of your breast. You don't want to implant this too wide because then it'll be under your arm. You don't want to implant this too big because it'll stretch your skin and make your skin thin. So these are the conversations you need to have. And this is why you should be talking to a plastic surgeon so that you can go over the risk and they can tell you what potential complications you face based on everything that you choose. So everything in life has risks, we know that, but we want to manage those risks. If you want to be smaller, this is where I put the asterisk. With documented symptoms and a definitive size removed, it can be covered by insurance. It's not automatically covered, but it can be covered. And this is when people complain of back, neck, and shoulder pain, if they have actually chest pain from the breast pulling, if they have rashes that develop under the breast, or they have moisture that develops and causes them to have odor. There are a litany of things that can cause you to have a desire to have your breast reduced in size. And so we see patients for both cosmetic, meaning out of pocket, and insurance coverage for this procedure. Next.
So do you ever do a mastoplasty and a breast reduction at the same time?
So a mastopexy, we're not going down in size. Remember, we're keeping the
Okay.
size, or we may be going maximum 1 cup down. Your insurance company has a minimum amount of tissue that has to be removed in order for them to pay for it. So that's not a mastopexy. A breast reduction means we have to remove a certain amount of tissue in order for it to be covered by your insurance. I always do a lift with my breast reduction because I don't know any other way. I'm not just going to make them smaller and leave them ptotic. I'm going to make them smaller and pull them up on their chest wall.
Got it.
But that's
Okay.
my approach.
Got it. Thank you.
Mm-hmm. So we'll go quickly through the next photos because I don't believe in before and after photos, but I'm going to show these just because. This is an example of a young person who had large breasts. There was nothing that she was going to be able to do to make her breast smaller. It began to inhibit the activities of daily living for her. She had difficulty even when she was in repose, lying down with her breasts either coming up on her chest and she felt like she had someone sitting on her chest, or they were pulling against her chest and she actually had pain. She had to wear a bra at all times. And so she became a candidate to have her insurance cover this. And this is her before and after.
Wow, that's amazing. And it looks like there's very minimal scarring.
Yep, it should not be lots of scarring because the technique that we use, we try to hide the incision. It's called a wise pattern reduction.
Okay.
Yep. Got it. Okay, this is a mastopexy. This is an example of somebody who had their breast lifted, right? So she wanted to keep the same amount of volume, just lift it up on her chest wall. And so this is what we were able to do. So she has to say, I did not take a lot of volume out of her at all. We simply just moved the position of the breast higher on her chest wall.
Okay.
You see that? You see that?
That's amazing. And again, it looks like, once she heals, the scarring will be very minimal.
Exactly.
And it's amazing that that's the same person.
Yep, same person. And she was incredibly happy.
I wouldn't. Yeah.
Yep. So body contouring. This is what we talk about. And that's, again, the trunk. So we ask patients exactly, I always start the conversation out with, how can I help you? Tell me what you would like me to do. And so if you have a discrete area of fat deposits on your abdomen, around your waist, what we call the flank, your back, your inner thighs, these are areas that we treat with liposuction. If it's, again, the word is discrete, small confined area of fat deposits, then this is how you have liposuction because you're only treating fat. If you have extra skin on these same areas, we then have to remove the skin. Liposuction alone could make it worse because then you'll have empty skin hanging. Remember, fat gives form. So if you remove the fat and there's extra skin, then there's no form and the skin just hangs down and it's not an aesthetically pleasing result. And so we don't do liposuction if there is extra skin. Instead, we do abdominoplasty, which is a tummy tuck. We excise the dorsal rows, which are the rows along the back people complain about under their bra, above their waist. And then we do inner thigh lifts to remove that skin that has accumulated in the inner thigh area. Okay. Next. So I always say, do you have a combination of all three? That's what I ask people. So consider if you said, you know what, I want to have my breasts done, I want to have my abdomen done, I want to have my back done, I want to have my thighs done. We stage the procedures and we stage them based on your immediate goals. What do you want to do first? What would you like to have improved first? And so what we do is we do extended lipo-abdominoplasty, which means we make the incision go around the body so we're able to catch those extra rolls you talk about, right? We do excision of dorsal roll skin. We remove the skin on the trunk. and then we do an inner thigh lift. We can do these in one setting. Our limit for time is 6 hours. So we have to do all that we can within 6 hours, or we have to have the patient spend the night. And the purpose of these procedures is so that people do not have to spend the night. And so that's why we say we have a 6-hour limit on these procedures.
And what's the so if they also wanted to have their breasts lifted, would that be a separate procedure?
It would have to be done at a separate time.
Okay.
So
Wow.
again, we'll quickly move through this. This is an example of a lipo-abdominoplasty. You see she had the liposuction of the upper abdomen. All the skin that was hanging over was removed, and then we liposuction to establish a waist for her.
That's amazing.
You see that?
Oh my goodness, yes. And again, I don't see a lot of scarring. I mean, I see some stretch marks that, you know, anybody has stretch marks anymore.
Right.
But that's really amazing. She must be thrilled.
She was very happy, very happy.
And probably broke because she had to go off and buy a whole new wardrobe.
Let me tell you, but that's a good broke to be, Bobby.
That is true. That is true.
Oh God. So
and is this that same woman?
Example, same thing we were talking about of the back. Go ahead, I cut you off.
No, I was just gonna say, is this the same woman?
Same person.
Wow.
Same person. And so we did liposuction of the posterior trunk. You see that? So we liposuction the trunk. You can barely see, but we had to make an incision on her back. I don't know if you can really see the incision to get rid of, you see those, she had two rolls and then an area of lipodystrophy right above her behind. You see that?
Yeah.
So we couldn't just liposuction because we have what? Extra skin. So what we had to do was actually cut one of the rolls out, and you can sort of see the scar, you sort of can't. And then we liposuction the rest. Do you see that?
Oh my, she looks like a bodybuilder now.
Mm-hmm. She looks great. She looks great because you know what? It motivates patients to get and stay in shape. So they go back and engage in the gym and the things they were doing before. They start to get back in better shape. And a lot of my patients already exercise, and there's nothing they can do about extra skin. I mean, they're already doing the most. They're already eating right. They're already exercising. They're living clean, all those things. But when you have that skin that has accumulated, it needs to be removed.
So what's the healing time between the picture, you know, if you did the surgery the day that you took the picture on the left, between that and the time you took the picture on the right? What's the healing term?
That's a great question. It's typically 6 weeks.
That's pretty amazing for 6 weeks. Wow.
You're not down for 6 weeks, but that's the time it takes to totally heal. You're probably down for about 2 weeks. I tell patients 10 to 14 days. And then you're doing your regular activities, but you're still healing.
That's amazing.
Mm-hmm.
Okay. So is there a specific age at which women anyone, women or men, should consider getting the surgery? I mean, if you're 65, are you too old? If you're 20, are you too young? I mean, is there an age window that is the best time to have the surgery?
So age is not a factor, except I don't operate on children. So in the District of Columbia, Maryland, and Virginia, that's typically the age of adulthood is 16. So I would do 16 and over. 65 doesn't scare me. 85 doesn't scare me. 20 doesn't scare me. It's how healthy you are. So it's all based on your medical condition, right? So if you have a condition that would make anesthesia risky, if you have a condition that would make you having surgery risky, then you're risky even at 20. I do ask women who talk about having body procedures, abdominoplasty, that kind of thing, not liposuction, but abdominoplasty, to wait until they're finished having children if they can, because you don't want to suture the muscles together, contour the waist, and have that incision if you're going to have that area stretched out with another pregnancy. For breast, we tell people the only issue is they may lose the ability to nurse after they've had a breast procedure, but they may not. We don't have a good number or good percentages on that, so it's hard for us to answer that question. But those are the only caveats as it relates to when you can have it done, what age.
And are you also getting more success, and I'm assuming that we are, because it's been a long time since I've talked about this, of maintaining breast and nipple sensitivity after surgery?
So I don't have a problem with that. That's not been something I've struggled with in my career. The techniques that I use maintain the ducts that lead to the nipple and to maintain the nerves that supply sensation. So I've not had that as an issue in my practice, and this is my 15th year.
Wow. And you also do surgical removal of skin after massive weight loss.
Yes.
And bariatric surgery as well, correct?
Yeah, so we have to share that. That's an entire lecture on itself. It's called post-bariatric body contouring. And that's so many procedures that we do. We tackle the arms, we tackle the thighs, we do the abdomen, the breast, the neck. There's so many things we can do, but yes, we do offer that. And that's probably about 30% of my practice. As you know, Bobby, the audience may not, that my partner is a weight loss bariatric surgeon, in addition to doing general surgery as well. But it's a natural flow of patients into my practice after they've lost their weight and their weight has been stable for a year. They become eligible to have some of that skin that has become excess removed.
Yeah, I actually was talking to one of your patients, and she's so excited. She's having her skin removal surgery in a couple of weeks, and she talked to me about her experience with Dr. Rickford having the bariatric surgery, and she is so thrilled to finally get with you and have the skin removed that she is just, it's shocking to think someone's actually looking forward to surgery, but she is really looking forward to this surgery.
Yep, it's the last piece in their journey, and we're here for them.
Yep, exactly. Well, this has been wonderful. Thank you so much.
Of course, my pleasure.
And again, if anyone has any questions, they can certainly reach out to you at your office number, which is 301-809-2013. You do see patients in National Harbor and in Bowie.
Yes. Yep, we're here to serve the entire area.
And we're here to serve the entire area. This has been wonderful. Thank you so much.
My absolute pleasure.
I appreciate your time today.
Thank you, Bobby. You have a great afternoon.
Thank you, Dr. Fripp.
All right, bye-bye.
Bye-bye.